Social determinants of health are non-medical factors that influence people's health outcomes. So it's not genetics, it's not actual disease that you may currently have. They are non-medical factors. So for example, transportation. That's not what we think of as a health determinant. But if you can't access grocery stores because you live in a food desert and also don't have access to a vehicle, you can access nutritious food. And most chronic diseases are diet related. Housing is a big one. We all know that there is a major housing shortage. If you don't live in a place that's safe, or if you have so much anxiety about your ability to even make your house payment or make your rent, that anxiety directly impacts your physical health. Homelessness, people who are sleeping on the street, there are direct physical impacts to that. That is a very unsafe way to live, and that has health consequences. There are 5 main categories: economic stability, healthcare access and quality, education access and quality, social and community contacts, and neighborhood and built environment.
So we realized, could we develop a brief curriculum that everyone could take? The whole university, not just health sciences. And then as we got into it, we realized, well, wait, there are many community groups that would also like this kind of training for their orientation. City government, county government, state government, with the support of United Health that was very generous in funding the development of this, what we feel is extremely important, learning vehicle. We finished 6 modules. It's not just information, it's also asking the engagement of the learner.
Each module is designed to take about an hour minimum, but within each module we have what we call Choose Your Path, where you can really dive into different topics.
One of the goals for the modules was to make sure that people from various educational backgrounds can understand the modules. So I think there's a lot of terms that are well defined, there's some repetition in there, so people can become familiar with various concepts and different modules and how they play together with various ideas.
Every module has learning objectives and discussion boards, and then the instructional materials.
I think they've been great. The graphics are beautiful and they adequately explain what the social determinants of health are and how they all play together. I would say also the readability is really good for people of various educational backgrounds. They also have some discussion points throughout for learners to stop and pause and think about certain things that we want them to focus on.
It feels really, really great to be part of something that I recognize as being directly impactful to health equity, which is a huge issue, and whether you're at the receiving end of these changes or not, it benefits all of us to have health equity.